So we are talking about ductus deferens, also known as the vas deferens, which is a muscular tube which is thick-walled with a narrow lumen. And in this image, you can see the vas deferens labeled over here, and it is a tube which is red all over, and that is the extent of it. Now it is going to be transmitting the spermatozoa from the epididymis to the ejaculatory duct. The epididymis has been labeled in this image, and the ejaculatory duct is in the proximity of over here. You can see the ejaculatory duct. This is the ejaculatory duct. Now I'm hoping you have a preliminary understanding. In this image, the anterior side is where we have all the labels, and opposite it is the posterior side. So you can see the testes labeled and the epididymis labeled and the vas deferens. This pocket containing the initial part of the vas deferens, the epididymis and the testes is known as the scrotum, and the scrotum is where the ductus deferens has its initial course. In its course, the vas deferens will lie in 4 different places/regions. You can quite see that ductus deferens is quite long. It is in fact 45 centimeters long. This is something they can ask in an MCQ. So the testes is anteriorly, the epididymis is posterior to it. In this image you can see the parts of the epididymis labeled: the head, the body and the tail. From the tail of the epididymis, the ductus deferens begins. So it is a continuation of the tail of the epididymis. So if they ask you for the origin, that is what you're supposed to write. Again, come back to over here. So from the tail of the epididymis, the ductus deferens arises in the scrotum and ascends along the posterior border of the testes. The testes has 2 borders. The border here is the anterior border. The border here is the posterior border, and you can see it is ascending along the posterior border. It is not quite visible in this image, but in fact, initially it will have a tortuous course, but which will eventually straighten out as it continues to ascend. So this part of the course is in fact the part of the course within the scrotum along the posterior border of the testes. Now after having left the scrotum at this level, it will now be in the spermatic cord, and it will have initially, you can see in the spermatic cord it has a vertical course, and it is in the posterior part of the spermatic cord. The spermatic cord is not shown in this image, but it is in fact in the spermatic cord in this part. It runs upwards. It runs upwards until it eventually reaches the superficial inguinal ring. In this image, let's see. You can see it in the scrotum. Then you can see the spermatic cord labeled in this image, and the second part of its course is in the spermatic cord. You can see this part is more or less vertical, and this is the first part of the course in the spermatic cord. Now you can see the superficial inguinal ring labeled. Then it enters into the superficial inguinal ring while still in the spermatic cord. So this is still the course in the spermatic cord, just the next part of it. So this course, when it was outside of the ring, was vertical. Comparatively, this is a more horizontal course. So it then continues in the inguinal ring until eventually it reaches the deep inguinal ring shown over here. Then the ductus deferens exits the deep inguinal ring and also the spermatic cord. So now it is no longer a part of the spermatic cord. So we're now talking about the third part of its course, which is in the greater pelvis. The pelvis is the area enclosed by the hip bone, and you can see the hip bone and the sacrum in this image, just one of the hip bones. And the part that is above the line, above this line or above this ridge, this part basically is the false pelvis, and this part below this is the true pelvis. The false pelvis is also known as the greater pelvis. So the course initially is in the greater pelvis. At the deep inguinal ring, it leaves the spermatic cord, as you can see. Now look at the label of the inferior epigastric artery. It then hooks around the lateral side of the inferior epigastric artery, travels across the external iliac artery labeled over here. You can see it. And then passes both backwards and medially. You can see this is the sacrum and that is located posteriorly. So you can see it is going backwards, medially because it is going closer to the midline, and you know that the bladder is in the midline. Now after having crossed this portion, it is in the lesser pelvis, and in the lesser pelvis it will have the last part of its course. The ductus deferens runs downwards and backwards on the lateral pelvic wall, and the bony part is forming the lateral pelvic wall. Deep to the peritoneum is lining the lateral pelvic wall, the bony part of it, so it is deep to it and it is on the lateral pelvic wall. It will cross the obliterated umbilical artery, which is not shown in this image, and it will also cross the obturator nerve and the obturator vessels, which are deep to the peritoneum, and it is itself deep to the peritoneum as well. What you can see is the fact that it is also crossing the ureter. You can see the ureter label, it is the tube in yellow. And now you can see that at this point it bends at an angle of 90 and bends medially, and then it enters a fold of the peritoneum. Before it was deep to the peritoneum, now it is in the fold known as the sacrogenital fold. Now in this image you can see the bladder and you can see the ductus deferens labeled. So at this point it has reached the base of the bladder, right? And what happens afterwards is that after having reached the base, it runs downwards. As you can see, this is superior and this is inferior, so it is going downwards, but it is also going forwards, मतलब सामने की तरफ भी. And then it, while doing so, while going downwards and forwards, it is medial to the seminal vesicle, which is this part over here. These are the seminal vesicles next to, right, lateral to the ductus deferens. This part is the seminal vesicle, so it is going downwards and forwards relative to the seminal vesicle, and then the ducts of the opposite side approach each other, as you can see, and then they reach the base of the prostate. This is the prostate gland and this is the base of the prostate. This was the base of the bladder, this is the base of the prostate, and the prostate is around the neck of the bladder. At the base of the prostate, the ductus deferens is joined at an acute angle by the duct of the seminal vesicle, as you can see, to form the ejaculatory duct, and the ejaculatory duct pierces into the prostate at its posterior border, posterior surface to be exact. So the ejaculatory duct is formed by the fusion of the duct of the seminal vesicle and the ductus deferens at an acute angle, as you can see happening over here, and the ejaculatory duct will enter into the prostate gland and be a structure within it, and the part of the duct lying behind the base of the bladder is dilated and tortuous and is known as the ampulla. You can see this last part is more dilated than the initial parts, so this is given the special name, the ampulla of the ductus deferens. Arterial supply, we have the artery to the ductus deferens. It arises from one of the terminal branches of the superior vesical artery, which is the artery of the urinary bladder. It accompanies the ductus with the testes, where it anastomoses with the testicular artery. So the anastomosis is in the testes, and it is a branch of the superior vesical artery. Veins from the ductus join the vesical venous plexus, so we have this intimate relation with the urinary bladder, which opens into the internal iliac vein. So the ultimate drainage is into the internal iliac vein, with the veins from the ductus joining the vesical venous plexus. So I'm hoping this was helpful. If it was, please like, subscribe and leave a comment.